Hi, my name is Efrat Seidenfeld. I am here with Dr. Eliana Aaron to discuss the recent corona outbreak. Hi, Dr. Eliana, how are you?
I'm doing okay, kind of busy. How are you?
I'm great. So there's been a lot of panicking going on the past few days with the coronavirus because there's been a few deaths and it's spreading to all over the world. What advice would you give to people traveling in order to prevent the infection and the disease?
So right now, the Israel Ministry of Health and actually the Center for Disease Control in Washington, D.C. have recommended cutting back on non-essential travel. So we recommend that if you don't have to travel,
So no vacation.
you shouldn't travel. That's correct, especially if you're going to areas that have started having some real outbreaks. Very important. The general rule of thumb for people who are traveling, because sometimes you do have to travel, is to maintain good personal hygiene, frequent hand washing, or using alcohol gel, like that. Should be at least 60-70% alcohol. This one's 70%, which is preferable. And this is only to be used on hands that are otherwise clean, soap and water on hands that are soiled. Maintaining social distancing is very important, and that means we don't want to get too close to people. Now, when you think about going through security at an airport and you're standing that close to everybody, it's very challenging to do that, but that is what's recommended, to stay away from people as much as possible, not to shake hands with people. High-fiving, hugging and kissing people is also something that we don't really recommend. And keeping your area clean. When you're on an airplane, for example, before you sit down, clean the area that you're going to be at.
So I have a question. Is hand sanitizer, is that better than washing your hands, or is it better to wash your hands, or both? What do you recommend?
Well, I'll tell you, washing your hands is pretty much known to kill a very high percentage of germs. Germs is a general term for microbes or bacteria and viruses. Alcohol does the same thing, about 99%, so this is slightly better than soap and water. But if your hands are dirty, then you have to wash them with soap and water, because this will not remove any dirt or filth from your hands. It will only sanitize hands that are otherwise clean.
What about masks? There's been a lot of back and forth. People say you should use masks, then they said don't buy masks. What do you think?
Masks have a very limited role in helping people not catch disease. They do not help people who are healthy from catching diseases from other people. What masks can help with is if someone is sick and they are wearing a mask, the mask will capture sneezes, coughs, and droplets. Not all of them, because they're not sealed.
Wait, so it's only good for people who are sick?
Yeah, that's where you get the real benefit, is when someone is sick and they're wearing a mask, it will block them from spritzing or from spreading the joy onto other people. It's not foolproof at all, but it does provide a barrier to collect those liquids. It's very important that because that's how coronavirus spreads. It spreads through respiratory droplets. There are high-level medical masks, but those have to be reserved and used for medical personnel. They have to be fitted to your face. If they're not fitted correctly, they can actually cause you to get sick. So we don't ever recommend for non-medical people or people who don't have access to be fitted correctly from using those masks.
I wanted to ask, if you're sick, if you have a cold, how do you know if you have corona or not? Do you get tested? Should you just stay quarantined? What do you do?
That's a great question. So I'm going to answer in terms of the Israel Ministry of Health latest recommendations. First of all, if you have traveled to any of the countries that are listed, and 5 more countries were added today, that would be Spain, Austria, Switzerland,
Germany.
France, and Germany. Pretty much have to go into quarantine immediately when you get into the country, 14 days of quarantine. If you have traveled recently and you start getting symptoms. And those symptoms are a cough, it's a fever over 38 degrees Celsius, and it's difficulty breathing or shortness of breath, respiratory issues. Any one of those symptoms, you may need to get screened. So the protocol for the general population is to call Magen David Adom, which is 101, is the number, same number for an ambulance. And you call them and you tell them, I traveled recently and this is what's going on. If you are in quarantine and you develop symptoms of the COVID-19 or coronavirus, then you must call Magen David Adom.
Even if you're in quarantine?
Yeah,
Okay.
because most people in quarantine are not getting tested. You only get tested when you get symptoms and they believe that you might actually have it. You have to go through a process of qualifying to get tested, okay, which means that you need approval from the district physician. In Israel, there are different Ministry of Health districts, and each district physician has the ability to determine if someone needs to get tested or not. And that's very important also, is that if you do have to go into quarantine for whichever criteria it is, if Magen David Adom or the Ministry of Health determines that you have to go into quarantine, you have to fill out a form to register on the Ministry of Health website to let the Ministry of Health know that you are in quarantine, because they are trying to help track people so that they know what's going on with you.
Sounds like they're doing a pretty good job.
They're actually doing a fantastic job. They are really working hard to contain this. And I think one of the really key points is that Israel's a small country, so they could do a lot more intervention here than you can in, let's say, the United States.
So for my final question, we've recently read on your website that you're in charge of many gap year students. Has this affected them, and has it been easier, more difficult, because you're dealing with parents too, and I know that they're probably very stressed.
This outbreak has affected gap year students in a few ways. Number one, gap year students, they travel. So we do have some kids who've been in quarantine. We have kids who are still in quarantine. We have more kids going into quarantine today because of the 5 new countries. Gap year students don't have a status in the Israeli healthcare system. So, I mean, that's part of what my company does, is to help get them services, because they are not in Kupat Cholim. And they're not really registered in the system. They're not tourists, they are students. So you have worried parents 6,000 to 10,000 miles away who are very concerned about their child. I think it's also emotionally difficult when you're not in a home. A lot of these kids end up being quarantined in a dorm. Being in a home environment is much more comfortable. All the protocols that the Ministry of Health built were called home quarantine protocols. Right. So what we have done is we've actually adopted those to fit into the gap year system and with the facts on the ground for the gap years. And they're completely in sync with the Ministry of Health. Excellent. And they've been approved. So that's why we have publicized our protocols and we are enacting them. And we're actually helping with some of the communication problems. We're considered health providers for this population. And so we're able to represent and advocate for them to get recognition and services that they need and be monitored correctly. We also have our telemedicine hotline. All of our nurses now have these protocols by which they could actually screen people live on there and then report appropriately to the people that need to know. Now, we are volunteering, by the way. The website is coronavirus.healthcareisrael.com. It's a dedicated English language website, news website, updating people on the coronavirus in Israel. We don't make money on it. We're doing it as a public service to help tourists and foreign students in Israel. So
that's really great. Thank you so much, and thank you for participating.
Pleasure.